The Deputy Director of the Africa Centers for Disease Control and Prevention, Dr. Ahmed Ogwell, said the continent has learned lessons from the Ebola outbreak and is better prepared to respond to the coronavirus. Dr. Ogwell recently spoke to VOA's Salem Solomon.
Indeed, Africa has learned from the Ebola outbreak of 2014-2016. And that is why when this particular outbreak started, Africa CDC is present. This is one lesson learned. During the Ebola outbreak of 2014, there was no Africa CDC. But the heads of state found it wise to be able to establish a continental specialized agency to address this emergency preparedness and response. So that is one. Secondly is cross-border collaboration. This has been a very big lesson during the Ebola time, and we are using it quite effectively now during this COVID-19 outbreak, so that countries are coming together and utilizing resources in one country to help the other country. And that way, each country does not have to have the full set of resources that are required to be able to address the outbreak, like laboratories, experts, and other experiences that come into play to address the outbreak. Third is that during the Ebola outbreak, the policy side was a bit slow to respond. And we've learned from that. And during this outbreak, health ministers came together very quickly and provided guidance that we as technical agency are using to be able to build the capacity and support countries on the continent. And finally, we also learned during the Ebola outbreak that we needed very close coordination with partners. And during this COVID-19 outbreak, we have mobilized partners from the very beginning, and we are working very closely with the various partners on the continent and beyond to ensure that we don't have a very large number of cases on the continent. So we've learned a lot from Ebola, and we are using those lessons to improve the way we respond this time around.